Oh, thank you, Amr. Well, listen, welcome everybody. I know that if you're in this session, this is an important question for you. And the good news is that despite what you read in the Washington Post, medical error is now the third leading cause of death in the United States. Everything from bad doctors to more systemic issues such as communication breakdowns. This is real data, and I think that the members of this group, this harm study group, physicians, take this very seriously and really want to try to generate best practices and guidelines and share amongst themselves how to do this surgery better and safer for all of you. But not everybody who has this operation is going to have the fortune of finding somebody who's that committed. And how do you find that? Don't Yelp your doctor. It's really different than restaurants. There are magazines that come out that give you restaurant recommendations, and there are magazines that come out that list top doctors. And many of the best doctors are listed in top doctors, but the methods by which those rating systems rank people are maybe quite superficial. And actually the doctor ones come from their peers, so those might be a little better. But there are a number of doctor rating sites that you may find as you do your Google search on your doctor. And these things are out here because they're making money, basically. They're coming more and more and more, and there's advertising dollars that get put with this. And the methods that they're rating doctors on, most of the doctors don't really think are the best. I would never look for a doctor by using these techniques. Now, it's not so clear why the easy things get counted in these things. And sometimes it's more like how you rated your Uber driver as well. You know, if you give them 4 stars or 5 stars because everything went well, but it doesn't really tell you much about the background and the training and everything else that your doctor may or may not have. Facebook is another place that people often land in doing their scoliosis research, and I guess I would just caution you here as well. There are many patient groups that are specifically scoliosis based that exist on Facebook. They're often private, they're kind of managed by somebody, and unfortunately the moderator of that may be an interested party that is hard to detect. So it's not so easy to understand what is the real science existing. It's not a bad way to share stories, but it's not a great place to glean facts. So I would be careful there, and I have monitored some of these, and I would say that I find more misinformation than truth in many of these things as you watch. So I would be cautious with Facebook as well. So what are you supposed to do if these doctor sites don't work and you can't use Facebook? I would say start with your primary care doctor. These people, and primary care docs and pediatricians are really, they take it upon themselves as part of their job, their responsibility to help refer you to specialists. When we consider our pediatricians mother hen-like figures, I mean, they take care of their flock, and they're going to take care of you, and if they can't give you a good recommendation, they've got friends and other colleagues who can. So if your primary care doctor can't do it, then start asking your friends. I'm sure if when you realized that scoliosis was now in your life, that you have acquaintances who also have scoliosis in their life someplace, and it's not that uncommon of a diagnosis. There are all of these surgeons who do nothing but take care of scoliosis. There's that much of it that all of us just do this every day for our lives. So there are other people out there, but ask around. The other is, if you have friends who work at a hospital, you've now got an inside source to that hospital, and let them ask some of their friends and their colleagues who work at the hospital. And I know a lot about the people in my hospital. I don't know as much about the people in other hospitals, but I can really help you If you need another specialist and I don't know who they are, I got the people to ask in my hospital, and I've got friends in my hospital who know friends in their hospital, in your hospital. So if you can get inside that system and get internal referrals, I think that also is very reassuring. You can do some online research, so I don't want to completely say that you should stay away from Google, but usually the doctor themselves will be associated with some practice, and that practice will have their bio on it. I mean, it'll talk about where they trained and what hospitals they're affiliated with and what university affiliations they have. And I think you can get a sense for what those universities mean and what those training facilities mean. It's not the whole story, but it's not a bad place to start. Some of these folks will be very engaged in research, and some of that research will be relevant to what you want to know about, and some of it won't be. We all are members of professional societies that most of which requires some qualification minimum standard to belong to. And the two important ones, I think the two most important ones for the surgeons are whether they're members of the Pediatric Orthopedic Society of North America or whether they're members of the Scoliosis Research Society. Those two organizations are where specialists that do scoliosis surgery get their professional education and mingle with their peers and find out how everybody else is doing. And if they don't play in that circle, then I guess I would wonder a little bit more. So, and I think you've probably learned on the internet already that if something looks too good to be true, it probably is. There are all sorts of promotional material that gets made and published on the internet that, sometimes it's just good information, and sometimes you can just smell it. You say, wait a minute, this doesn't seem right, and it can't be that good. So I really enjoy this quote from Albert Einstein. I think it's pertinent to this discussion as we're talking about how do you find the things that matter about your surgeon, and not everything that counts can be counted is really right. So when you're trying to figure out what counts about your surgeon, some of those things can't be counted, and unfortunately not everything that can be counted counts. And that's the other problem with the rating sites. The rating sites can count how many empty parking spots you have in your hospital parking lot and how long the waiting time was in the waiting room, but they can't count very well how much your doctor cares and how dedicated they will be to doing what's best for you. That part's a little harder to count. One of the things that is clear is that volume matters, and people who do this operation a lot tend to do it better than people who don't. And it's not to say that the absolute highest volume is absolutely the best, but there's probably a minimum at which we start to see some difference between surgeons who do this every day versus people who do it twice a year. So this is a study that was published. It's actually from data out of California, but New York and California surgeons involved, and identified that volume does matter. Dr. Shaw mentioned that this idea that there are best practice guidelines that we should all follow, and the development of those guidelines doesn't necessarily exist in all the areas we would like them to. One of the missions of the Harm Study Group in Setting Scoliosis Straight is to do the research that will substantiate these best practice guidelines and allow us to determine which things should we all be doing the same and which things is it okay to have some variation. But in general, if you reduce variation, you come up with a better quality product. And so improving the quality of care is dependent on reducing that variability. We want to take waste out of the system. The medical healthcare delivery system is a very expensive system, and we'd love to figure out how to get rid of the waste and still have the best outcomes. And if you can do those two things, you'll increase the value of care that we can deliver. So this group is very committed to do that. And you want to make sure your doctor's on board with this concept of doing is the very best that the society and the community of surgeons have decided to be the very best. This concept of where is your center or your doctor on this bell curve. There is variability in the system, some of which matters and some of which doesn't matter. And again, if we can move this to be more standardized and safer, we'll improve the quality. It's also true that there's probably a possibility that you're too slow or too fast, either in discharge or in your surgeon's operative time. So we rate ourselves amongst our group. We compare each other to ourselves. We look for who's doing it better, and we try to emulate the practices of the people who are performing the best in each of these areas. And I think that's a really valuable tool for all of our surgeons and centers, and also helps set a standard and an expectation for how long surgery should take, for example. One other is in postoperative infections. So it turns out that the average overall rate of postoperative infection is just under 1%. And this is a number that we would love to drive to zero. How do we reduce this number? Well, one way is to try to understand what are the risk factors that lead to an infection. The fact that you've had a surgery and an incision, unfortunately, gives you some risk of having an infection. No matter what we do, we haven't been able to get this to zero. But if you look at the variability that exists amongst the different sites who do this operation, you can see a couple of things. And it turns out the reason obesity is in the first column, the percent of patients who are obese, is because that turns out to be a risk factor for infection. So the thicker the soft tissue, the greater the risk of infection. And if we normalize patients' infections rates based on their risk factors, we can get a risk-adjusted infection rate. And you can see that if we can study what's happening at site number 5, the risk-adjusted infection rate is 0.2% as opposed to 0.9%. How do we take that practice and get that standardized across all of our systems to help drive that rate to zero? So I think there is a possibility that we keep driving these rates lower and lower and lower. It involves research and us studying the outcomes, and unfortunately a lot of these things aren't quick, simple fixes. They're multifactorial, and understanding what those variables are is part about what this group does. So you've heard that the risk factor is some about your doc and some about you. You'd obviously like to optimize your risk factors. We just talked about that one particular one for infection, but the issue of nutrition was brought up. There are all sorts of things, some of which you have control over and some of them you just don't. If you have a bigger curve, it's probably a little bit more difficult and more dangerous than if you have a smaller curve. But again, you don't want to have an operation at a time when you don't need one. The other variables about doctors, and not just doctors, but anybody that you interact with, these were the 3 A's we were always taught in medical school. If you want to get out and be a successful doctor, you have to be available, affable, and able. And I put them in order and an emphasis on how I think you really want to find them. Some of the people who are available because they're not able. So watch out for that. A long wait list is not always a bad thing. Affable is obviously very helpful in developing the relationship and the trust that you need to have with your physician. But ultimately, you really want them to be able to do the job when you go to sleep and those operating doors close. They've really got to be able to do it. This is a very technical operation that requires knowledge and skill to do well. So you really do need to find someone who's able. On top of those 3 A's, I wanted to add some other things. You really need to have a sense that your physician has your best interest first. And I can tell you that that is 99% the case in medicine, but it's that 1% of kind of bad apple that exists in all of our society that you want to find. They unfortunately live in our profession as well, and you don't want to get stuck there. All of the people who provide care in healthcare generally are empathetic people, and that's kind of what drew them into this field. And I hope that you're fortunate to have a physician where you sense that as well. We talked about knowledge and skill, and the group of people that I work with at our institution and within this group and within these institutions that are in the Philadelphia area are committed to excellence. And you really want to make sure that you have people who want and are certain that they'll do the best job. Ultimately, a trusting relationship needs to be developed. And that's, sometimes a little bit difficult to do when you've got a really stressful situation that's coming. And developing that trust takes some time, and it takes just a little bit of work. And it doesn't happen overnight. So be willing to spend some time, get to know your surgeon, get to know their team. The nurses and the mid-level providers and their therapists are the people that you may ultimately end up knowing the best, and they will also give you a sense of the trust of the system. In the end, I think you just have to kind of listen to your gut a bit. There really is a lot to that kind of just instinct about, do I have the right person for this job or not? I think we all have that sense that we've either hit it or not. So anyway, those are my thoughts on how you might try to go about navigating this tough job of finding somebody to take you through this challenging surgery.